All right, everybody, good morning. Today is day 5 of budget hearings. We have 4 different departments on the calendar. I will say, I'm going to sound like your teacher, I think, when I say this. We break at 11 and we come back at 2 if necessary. So, if you all want to be done at 11, we can be done at 11. If people want to come back at 2, we'll be back here at 2. The choice is yours. I certainly don't want to say that in a way to take away from the fine work that everybody does and make people feel like they need a rush, but I just also want to put on the table. So with that, thank you, Danny, and your team for being here. We look forward to your presentations.
Thank you, council member. We very much appreciate the opportunity to present to council. I wanted to introduce everyone at the table here. To my left is Lindsay Hortenstein, Deputy Chief Administrative Officer and Communications Director. Danielle Berger, our Chief Administrative Officer and Deputy Chief. And Barksdale Hortenstein, our Director of Mental Health Unit. Together at this table are decades and decades of public defense experience and public service. And OPD is special in a lot of different ways, but primarily it's the people, it's the public servants that serve New Orleans and are dedicated, talented, caring, and work tirelessly for dignity, justice, and hope for our most vulnerable in New Orleans. 2020's parity law has closed the funding gap between public defense and prosecution and enabled us to strengthen our ethical, professional, and constitutional obligations to our community. Over the last year, we have prioritized meeting the moment and doing everything to fulfill our constitutional requirement to our clients, our community, through zealous and robust representation. I don't know if the word has gotten to you, but trials have been at a breakneck pace, more than I can remember in my 20 years of public defense, and OPD continues to keep up and do everything we can through tireless effort. We continue to focus on our alternatives to incarceration through our work of our Client Service Division through immediate post-arrest advocacy, client support, and case management. Specialized mental health representation and mitigation efforts to seek to meet clients where they are, support them, and work to get them in a better place than when they first came to us. In short, our office, the Public Defender Office, increases health and safety for all of New Orleans. During the fiscal year 2025, we represented more than 19,000 cases across 26 sections of criminal district, municipal and traffic, and juvenile courts. Additionally, we have had more than 500 cases as I speak that are being prosecuted by the Attorney General here in New Orleans that are related to LSP Troop NOLA arrests. In just the first 3 months of 2026, July through September, we have seen a breakneck number of cases. And if this number holds, we expect to be having an increase in our workload for our fiscal year 2026. Our Client Service Division is the core of our collaboration and collaborative representation model. Through client advocacy, case management, social work services, we work to strengthen community health as well as public safety. By prioritizing the needs of clients through holistic approaches, we not only address the acute needs post-arrest, we work to stabilize and support clients through their medical and mental health services, treatment programming, and other supportive services. Our team of client advocates, including peer, parent, youth advocates, together with social workers, saw more than 1,300 of the most vulnerable cases, with frequent social services issues being substance abuse treatment, mental health related needs, and pretrial advocacy. Each year we talk about the extraordinary work of our client services team and the significant impact their advocacy has had on the discrete needs of our individual clients, as well as the health of the overall community. Just a few examples. For instance, a client facing housing instability and serious mental illness is struggling to meet probation requirements. With the support of their advocate, a release plan was secured, shelter, medical care, probation support, and instead of being revoked for 3 years of jail and prison, he is now stable in the community and fully compliant. This kind of work is repeated every day at OPD. Another client was unhoused and on active addiction at arrest. Our team advocated for treatment instead of incarceration. He was admitted to an inpatient treatment program, reconnected with his family, found work, and remained sober and out of the criminal legal system. Finally, another client was arrested during a serious mental health crisis. The bond was reduced after we submitted a release plan that included a wraparound support from the FACT team, community partners, and client was stabilized and ultimately in a much better place after his arrest than when he was arrested. Barksdale Hortenstein has spent the last 10 years working to address the intersection of mental illness at our office in the criminal legal system through direct representation as well as strategic partnerships and systemic advocacy. Barksdale?
Good morning. For the past 20 years or almost, I've been working at the Public Defender's Office, first as a line attorney and then as a supervisor and now as the head of the mental health unit. I've been asked today to share a little bit about that with y'all. In that capacity, as the director of the mental health unit, I've been the lead attorney for serious cases, people facing life imprisonment. I supervise attorneys representing people with serious mental illness, which can create very difficult attorney-client relationships and hard work. I have been local counsel to the capital cases that have come through. I work at the intersection of mental health and criminal justice, whether through the direct representation or in policy. I've been asked and appointed to a statewide working group to reform competency to stand trial statutes by the legislature of the state. I've been the crisis intervention task force participant in the city council's attempt to create and successful attempt to create a non-law enforcement response team for individuals experiencing crisis on our streets, which is one of the most successful programs, I'm glad to say. And also, participated in the Behavioral Health Council's attempt to create judges' tools and bench cards for courts to be better at understanding and working with people with serious mental illness. Whether it's in this capacity or presenting CLEs, speaking publicly in opposition to Phase 3, I have an opportunity, because of the relationships I've built over the course of that time, to be a trusted voice in those rooms and to work towards an improved life for people with serious mental illness in our community who are far too often punished. You cannot treat cancer by punishing it. Similarly, you cannot treat mental illness by punishing the people who are exhibiting those symptoms. And far too often we have criminalized those symptoms and attempted to incarcerate our most vulnerable New Orleanians rather than treat them. It might be a more expensive option at times, but it is the right option. And I'd like to advocate for that today. Seeking to provide dignity to our most vulnerable clients has been my great privilege over the past 18 years.
Thank you, Barksdale. And you all heard yesterday the incredible voices from the community about the Instead program. And it is this council's resources for our office and that has borne out Instead. Alum from our client service division had the idea, worked in partnership with Barksdale, with the district attorney's office, and therein lies one of the many examples where our work achieves good life outcomes and more health and more safety for the city of New Orleans. As requested, the following slides show a breakdown of our personnel and organizational structure for a fully functioning public defender office. For 2026, we cannot reiterate, council members, that public defense is entirely reactionary based on the demands of the system. We must balance and adapt to the ever-changing needs of our clients, community, and for the cases that come to us through arrests in the criminal system, while also ensuring that we meet our constitutional, ethical, and professional guidelines required for public defense. When we fail to meet our constitutional duties and our ethical and professional guidelines, the entire system falters and our community suffers. Yet we remain nimble and committed to ensuring high levels of service and representations for our clients and community. OPD puts the vast majority of our resources to direct services. We take a resourceful approach to everything we do to ensure our clients receive the best representation possible and are constantly challenging ourselves to continuously improve. We have and must continue to meet the needs of the moment. That includes the increased demands on our client teams through the trial pace that I mentioned earlier, overall efficiency through paralegal and trial assistance support, and allow us to better meet the needs of our clients. We will continue to focus on alternatives to incarceration to put our clients in a better place after we initially come in contact with them through partnerships that we have discussed and an ongoing effort to put our community in a safer and healthier place. And we remain committed, and we've heard a lot of discussion even in the early hearings, to reducing the jail population. We've done it before, council members, and we can do it again. And I'm going to say it out loud. I think we can get that jail population to 1,000 in a short period of time. And we will need the resources through all the criminal justice agencies to be able to do that. Over the last year, we have confronted significant challenges that have strained our resources and substantially increased the impacts on our clients' community. This includes increased arrests through the state police troop NOLA, an additional prosecuting entity of the Attorney General's office and criminal district court, increased bond amounts requiring more immediate post-arrest and first appearance advocacy, crisis of the jail population, and increased sentencing and risk exposures with the elimination of parole and good time, more use of the multiple bill statute, and the rollback of the raise the age with the 70-year-olds returning to adult court. While we remain and will maintain a comprehensive ethical and constitutional representation, we must also work to do everything we can to meet all the overall demands, shrink the system, and make our city a healthier and safer place. This is critical for the sustainability of all system actors in the community at large. Last year, we recognized that the 2025 budget was right-sizing city services, including at the OPDA and OPD. That was response to the needs of the system. In that prior slide, we said most of our budget goes direct to direct services. In fact, 2.5 million of our operating expenditures includes professional services, specifically contract lawyers, investigators, social workers for our conflict cases, expert witnesses, required audit services, and the juvenile representation passed through to LCCR. Ladies and gentlemen of the council, we are asking the council to lower the reduction percentage that is proposed of over $3 million to our office. We are not able, plainly put, to absorb that. While we understand that this is a time of austerity, this substantial cut will lead to vital positions not being filled and have significant impacts on the core works of our clients, the most vulnerable, and the core services that we provide directly to the people of New Orleans. And frankly, will actually increase the cost to the city. In the 20 years since Katrina laid bare our criminal system, we have seen a dramatic transformation of public defense in New Orleans. We have been, frankly put, a success story of government and public service in those 20 years. We have worked to address head-on the concerns of our community and injustices of the system that made New Orleans the wrongful conviction capital. Katrina made way for the change the system needed. And in 2020, this council did something truly momentous and forward-thinking by passing funding parity. New Orleans remains one of the few municipalities that equitably funds public defense and prosecution, and we see the results in protecting innocence, serving the Constitution, and making our community healthy because of that funding parity. This is something that we should be truly proud of. We know it contributes to more just legal outcomes, protects innocence, and prevents wrongful arrest and conviction, increases our ability to identify and address the root causes of system interaction to our clients, quite often due to medical and mental health concerns, poverty, and trauma. All of this combined seeks to improve our clients' overall health and safety, as well as the health and safety of our community. We know that we can judge a society by how it treats the most vulnerable. Ladies and gentlemen, OPD is who works directly with the most vulnerable. New Orleans should continue to demonstrate its commitment to the constitutional rights of our community and show it cares as much about protecting its community members as prosecuting them. And we thank you for your time and are able to answer any questions that we have.
Thank you. Councilmember Harris.
Thank you. You touched upon this, but I really want to put a fine point on the impact of Troop NOLA and the Louisiana State Police presence here and how that's impacted your caseload and services that you must render.
One of the things that we're seeing on the ground is that most of the Troop NOLA arrests tend to be mid to lower level felonies related to either pedestrian stops or traffic stops. And so what that has done has squeezed our case teams that represent that mid-level felony caseload. And so while we have a great story in New Orleans of crime reduction, violent crime reduction, what we are seeing is actually an increased workload that both relates to arrests, not only from Troop NOLA, but across New Orleans, specifically on those mid to lower level felonies.
Are you receiving any additional state funding to supplement?
Our state funding is through a district assistance formula, and we have been receiving consistent, steady district assistance formula from the state. One thing that we've done in recent years is partner with the state to get federal dollars. So we have been accessing federal dollars with our partners at the State Public Defender Office, specifically around a grant for child in need of services. So you see additional funding that comes through pass-through funding through that partnership. And we've just met the other day with the state chief we're going to go to the state legislature specifically around the housing fund, or excuse me, the office fund that has been happening the last few years with other districts and seeking to get that support from the state.
I guess my point is this: your workload is increasing because of the presence of Troop NOLA, Louisiana State Police, but you're not getting additional funding from the state to help the impact of that workload. Is that correct?
They've been steady in their funding, and our numbers have shown increases over the years. Specifically tied to that, no, but I do think we've had good partnership and continued funding from the state. And by the end of the day, council member, we have an obligation to represent our New Orleanians, regardless of who's making that arrest, whether it's the levy authority, the sheriff, the state police, or the New Orleans Police Department.
Okay.
And we take that very seriously.
I want to turn to Instead and LEAD and the impact of those two programs on the work that you do. I know we talked yesterday about Instead, but just for the millions of people who are watching and the people in the audience, if you could talk, Barksdale, a little bit about LEAD and Instead and how that impacts the work that you do.
Yeah, it's just fantastic to have programs that actually work and that accomplish in-community care and treatment for people with mental illness, which is the gap in our resources. There's still large gaps in resources in the city of New Orleans for the treatment of those with serious mental illness, intellectual disability, developmental disability. But with the partnership with the district attorney and the mental health diversion, we're finding a way to get people out of the sort of gears of the criminal justice system and into the treatment that's to be provided by actual caseworkers and social workers, by providing opportunity to get to these appointments that are so often missed by people who are suffering from disorganized thought and a difficult time getting to where they need to go. It's only because of this partnership with the DA on the mental health diversion that Instead's able to get clients diverted from the criminal justice system and the auspices of long periods of incarceration that will then lead to longer periods of incarceration. We know that, we see that. The recidivism, of course, but also just the extended periods of time of the destabilizing nature of jail, which leads to additional incarceration and more charges. And so we're really thrilled with the success we've seen of those programs.
And I would just add,
Go ahead.
Councilman Harris, I'm really thankful for the council support, not only for our office, but also for Instead last year, because what we've seen, especially in decades of working in the criminal justice system, is often we get outcomes that make things worse, right? Either you get a short period or a middle period of incarceration and the person is more destabilized upon return without the sort of improvement that we've seen through our work and Stead's work and in collaboration with the DA's office. That I think we're starting to turn around with these innovations and with what we're doing in the city of New Orleans. We're not making outcomes worse. We're making them actually a little better for both the individual, their family, and for the community.
Barstow, you also said Mobile Crisis Intervention Unit was one of the most successful programs that you've seen, and I know the health department is coming behind you, and we'll probably talk more about it. But can you tell me why it's one of the most successful?
Well, I mean, obviously, in its provision of services to those that are experiencing crisis in our community, but for me, it's in eliminating the law enforcement involvement in that, because mental health crises are medical situations that need medical treatment, not criminal intervention or justice intervention. And, you know, one of the things that I think is most highly successful in their intervention is their rate of successful interaction with community participants that do not lead to situations of violence or situations of threat for the person in crisis or for the responders. You know, we have they have a great dashboard that shows their data, and they have long maintained a high 90s, maybe 98 and maybe 99% response rate where they have no fear during the interaction of any kind of harm being visited upon them or any kind of threats that they feel to their safety. And I think that shows the success of a program that doesn't involve law enforcement, where the incidents of violence are going to go up because you're escalating. Anytime you're escalating, then there's an increased chance of violent encounter, and we're seeing, you know, we've seen a precipitous drop in that, and I'm excited for that. I think that there's more work to be done in that area.
Thank you.
Councilmember King.
Thank you, Councilman Caruso, and thank you for the presentation to the Public Defender's Office. Just want to highlight, something that was mentioned yesterday, how a cut across the board isn't felt equally amongst different departments. So yesterday, I forget who said it, but we was told that it's about $130 per day to keep somebody in jail. So about 50 days, that's roughly $7,500. And the longer you stay in jail, so that's one negative to staying in jail, because that's costing the city on the back end. The longer you stay in jail, the more likely you are to lose your job, or your family goes without that structure at home. So that devastates the family dynamic. Also, you have more of an opportunity to add to your sentence, or add to your, you go to jail fight, or you have, you know, whatever, that makes things worse. And if you defund the Public Defender's Office, the chance of your prison stay or your jail stay being increased will grow. So as if the city, and I know these are some tough decisions that we have to look at, all departments being cut or maybe not being cut as much, but it seems to me if you cut the Public Defender's Office, and quite frankly also the DA's office, you will increase the length of jail stays for people of our most vulnerable. And by increasing those length of jail stays, in the end, the city pays for it because it costs more money to keep people in jail. Those individuals pay for it because they are in jail. They could possibly lose their job or lose whatever assistance they have. Their families are more likely to be turned upside down because mom and or dad, they're not home to bring children where they need to go and be that parental figure. And they also have a greater chance of getting into trouble in jail. So I just want to highlight that, once again, all departments, all cuts aren't created equally. Some will feel it more than others. And as a whole, the city will feel certain cuts more than others. And I think this, once again, is a good example, and this department highlights, along with the DA's office. I know they have their own presentation to follow in a few days, but this is one time where you all are kind of saying the same thing, that a cut to either side will prevent them from making prosecutions, which will, or doing their investigation, we can get somebody to jail sooner, and you all can't defend with the same amount of, with the same ability, because you have less finances to do so. I just want to highlight that for for the audience and for the administration, and for our colleagues, my colleagues who are listening, that all department cuts are not created the same, and the city will feel more than others. And I think this is an example of feeling more, of us feeling it more as a city.
Yes, thank you, Councilmember. I obviously couldn't agree more, but I think one thing that what is unique to what you just said is that we will actually see increased costs very soon, even in calendar year 2026 with these proposed cuts, and certainly pretty drastic long-term cuts that the city can't afford. And every dollar invested in the work we do saves us many more dollars in both in the immediate term, but in the long term as well.
So can you speak to those increased costs that we will see if your budget is cut as much as being proposed?
Well, just as before the historic parity law, you know, in the bad old days, we had a jail population of over 7,000, with over 4,000 just in pretrial custody alone. And those costs just to the city and the percentage of the budget for just jailing people and the health treatment required for people in jail was pretty astounding. And so while we have work to do, and I don't want to underestimate how important that work is and what we do every day to get that jail population lower, this will take us backwards rather than forward. And I think we've been in discussion with the district attorneys. I think you're going to hear them say this really important goal of getting that jail population under the 1,250 permitted population from this council, but even as low as 1,000. We've been in really discreet work and conversations to both put the increase, hold the increases at bay, which we've seen, even though it's way too high, but also being able to get that to be much lower. And so that's just the direct cost. But as we saw with our mental health unit, with our client service division, with reduced services across the board in those fields, in those areas of our office, you will see those costs borne out with worse outcomes for clients and worse outcomes for the community for those more increased health crises for the clients that we serve.
And one last thing, Councilman Jerusalem, and I'm done. People, we always, a lot of us, well, I think everyone wants the jail population to decrease. And that's not only on the sheriff, that's not only on, can you explain the public defender's role in helping with the decrease of the jail population?
That's a great question. I wish anyone, and we invite the public and anyone who is interested in joining us to just go into court every day with us. Twice a day, 7 days a week, we are at what they call first appearances, where a client is brought to court immediately after, within 48 hours of their arrest. And what we do, not only at that hearing, is start getting information, connecting them with family members, getting a conduit to either make a bond or make the advocacy for a release, but also go to work almost immediately. One of the things that we're most proud of is that we do that work in magistrate court, in screening for people who are incarcerated, for zealous representation and wraparound services for folks who are incarcerated. So what we're doing just on a daily routine is not only advocating with our bond team that was initially funded through the MacArthur Safety and Justice Grant, but has been absorbed within our budget, but also each individual client gets bond advocacy within that magistrate period. But you can even take that even further. We saw one of our sections of court drastically with really intense work from both our offices at the public defender and the DA's office get down from close to 500 to close to 200 for a docket that was in the media recently. And that was laser focused, hard work, weekends, nights to both prepare resolutions, go to trial, get ready for trial, and all the things that happen once a case is begun in our system.
Thank you.
Thank you. Councilmember Thomas.
First of all, thank you guys. I mean, the data has already been done when you talk about the financial and social imbalance. So, I mean, it's been hiding in plain sight for decades. I think in this state, you talk about millions in this country, it supports. When there's a major imbalance, it's billions. So we don't need to take a look at empirical or financial or social data anymore because they've been projects like the Innocence Project or wrongful convictions were born out of the imbalance. So I think the challenge now is how do you strike a social and a criminal justice balance so that you don't create more hardship socially as well as economically. And what I think people forget is at the height of when many urban areas had the most people incarcerated, the largest law enforcement or police forces were actually when crime was actually at its highest. In New Orleans, I think it may be about 17 straight years. So I think moving forward, the question is going to be, how do you enact social justice, economic justice, and criminal justice? And that's not to say that you don't need law enforcement, you don't need a court system that punishes the people, that small percentage of people who enact most of the most heinous crimes. But in this age we're in right now, where it's trending the other way, against criminal justice reform, against lock them up and throw away the key, all you have to do is look at the research that's been done already. And if you look at the research that's been done already, you don't have to guess about an issue out here. Communities have cost themselves millions, in this country billions, by not understanding the importance of what's Lady Justice and is blind. Well, I don't know that she's ever been blind when it comes to communities where people like me and Robert come from. She was always peeking, but at least with reform, the blindfold was a little thicker, and she had to pull it down when she wanted to see who she wanted to punish. So let's just hope that at some point moving forward, you guys have enough advocates that understand the data that's there already.
Yes, thank you, Councilmember. And that is why I think one of the reasons why our ask to not make those cuts as drastic as they are is so important, because we really have turned, I think, the page where it was once perceived it was better to be rich and guilty than poor and innocent. You go into our courthouse every day and people really feel like they're getting a fair shot. Their representation is not determined on how much money they have in their pocket. And so, and that is something that we should be proud of, and we don't want to go back. We need to keep moving forward.
Well, wrongful convictions, judgments by the state, cost of criminal justice, cost of incarceration. So, all of those studies are there already. So the question is whether people want to read them, understand them, and strike the balance that we need to make sure that people are safe. Bad people, the ones who make a choice to be bad, are in jail, and that we begin to deal with some of the root causes of the injustice that happen, that are being threatened now by this movement federally, the movement statewide, and in many cases, locally, y'all are going to find out.
Yes.
Because you don't have enough people who understand the realities of what it costs.
Thank you, Councilmember.
Right. Thank you, Councilmember. We have 2 comment cards here on this issue, Bruce Riley and Remy Abiodun, and thank you for putting that phonetically for me. Bruce was here. There he is. Hey, Bruce.
Members of the council, Bruce Riley with a vote. Just want to say that whatever the public defender is asking for, it's not even enough. I think he's just being realistic about maybe what he feels he can get out of y'all. But this is the biggest bargain for constitutional protections on the books and all parts of the budget. If we want to talk parity, we're really only going to have parity when the investigator arm of the public defender's office matches the police department's arm of that side of for the prosecutor's office. There's so many vacancies already, as you saw in the outline, and they need to staff up. And we're only just starting to look at a real justice system here in New Orleans over the last decade. And I encourage everybody to inform themselves of what it used to look like. Some of you may have more experience in the law than others, but I would suggest that if you want to understand about wrongful convictions, you can start by reading The Jailhouse Lawyer by Calvin Duncan and understand that when people are wrongfully convicted in this society, the system should be saying, I am sorry, and making right, not continuing the pain, continuing the wrongful conviction by calling them names, whether it be publicly or privately. I know so many wrongfully convicted people, including at least one that's here in this building, and I don't know how many times that I've seen government officials on behalf of the government say, I am sorry, we wronged you, and maybe at least put a little money in their pocket. But instead, we just try to move on, and Lady Justice may be blind and carrying a sword, but she's blind because she stabbed herself in the eye. Thank you.
Thank you, Remy. Good morning.
Good morning. You're welcome for the
I
phonetic
appreciate it.
pronunciation.
Thank you
Happy
so
to
much.
help. Good morning, everyone. My name is Remy Abiadoun. First, I'm a native New Orleanian, and I'm a concerned resident. I'm also a juvenile public defender, an employee of the Vera Institute, and a proud member of the Big Easy Budget Coalition. First, it's the federal cuts to social services. Now it's the proposed budget, the city budget, which makes cuts to programming aimed at our most vulnerable New Orleanians. We are exacerbating the social determinants of crime. We are showing New Orleanians an increase to police, but a decrease to the public defender. The proposed budget cultivates conditions where crime will go up, not down. And if that's not enough, there's a proposal to cut funding to OPD. We know that the criminal justice system is a dumping ground that reflects disinvestment and budget failures. Creating more crime than taking money from the organization required to defend the rights of those navigating this system is short-sighted at best, but at worst is just plain irresponsible. So let's fund the Big Easy deal, which rejects cuts to health and social services, supports social programming that keeps crime down, and then fund OPD to protect the rights of our most vulnerable New Orleanians. Thank you.
Thank you. All right.
Thank you, Councilman. I also wanted to just thank Kristen Rome, who's Executive Director of LCCR, who's here, who works tirelessly on behalf of our children every day, and appreciate your time. Thank you.
Thank you. All right, let's get ready for health. I'm going to look at my colleagues. We have like almost 20 comment cards on health. We said we're going to cap them at 5. So do you want to stay at 5 or you want everybody to have their moment? Let everybody? What's that? I can't hear.
Just in light of that, is it possible to do without a motion 1 minute each?
Yeah, I mean, that's what I was going to think is maybe instead of doing 2 minutes, we'll do 1.5 minutes each. And then that way we'll get through them. And I want everybody's voices to be heard. So what we'll do is 1.5 minutes for all the health cards. So that's an unfair. All right. Good morning.
Morning.
And happy birthday. What better way to spend your birthday?
I can't think of a better gift than to be able to present the work of the health department, and I mean that seriously, I really do.
Got it. Yeah.
Good. Excellent. Yeah. See if that works. Yeah, try this. Yeah. All right. We don't seem to be able to advance the slides.
We're coming.
Oh, wait, here we go. Just scroll.
All right, great. See?
So good morning, council members. Thank you for having me. I'm really honored once again to be able to present the work, the outcomes, and the challenges that we face at the health department. But I want to make it clear from the beginning that whatever successes we have and whatever challenges we face, we do so with a broad and deep coalition of partners. We believe truly in the model of collective impact because we know with our small footprint and small funding allocation, the New Orleans Health Department can only do so much. But thanks to our strategic partnerships through our Community Health Improvement Plan with hundreds of organizations, both small and big and everywhere in between, that's how we get things done. We believe that public health is a ground game, and so we need folks in every part of the community to do the work in partnership. We have shared accountability, we focus on outcomes, and we're really, really proud to represent all of them. This is some of the logos, not all of them. Some of them, I really want to send my appreciation to everyone who's here today in support. It's incredibly meaningful to us. When we have a little, we can deliver a lot because of these partnerships. Go ahead. Yeah. Oh, I do want to introduce, thank you, Ms. Jocelyn, everybody that's at the table. Ms. Jocelyn Johnson, who is our fiscal director, Jeannie Donovan, and Ms. Shawn Sadiq, who you all know very well as our deputy director. So I'm honored to have them here today. I just want to set, I know we're not talking about successes or year in review, but I do want to set the stage that we have some overarching goals that really drive what you're going to see in terms of our plans for next year. And it starts, continues, and ends with our goal to dismantle historic health inequities in the city of New Orleans. That work started long before us, but we have really tried to advance that through everything we do. And next year is going to be no different. We continue to strengthen our capacity to delineate and to address key drivers of health inequities. We do that by working better together as a health department through our units and with our partners. And we always have a goal in mind of evidence-based scientific practice that we know improve health outcomes. We do this rooted in community. And when I talk about our programs and what we serve, you'll hear that. But it's also just being in community ourselves, getting our face out there. It is our goal to partner on events, big, small, everywhere. If you look at our calendar, just our vaccine events alone are all over the community with every kind of partner you can imagine. We just want to get our face out there. We want to be a trusted government agency. And then we're getting ready to launch a new cycle. Our most recent community health assessment and plan started right before COVID and has persevered since with some pretty good successes despite all of the challenges. But it's time to see where we are now. And it's time to set the direction for the next 5 years. And it's time to do it in a very systematic way with everyone at the table. That'll help us get to our 2027, our third reaccreditation, but I think we're on track. So when we talk about our plan for 2026 and the goals of the health department, again, we do it under our strategic framework of the Community Health Improvement Plan. This past cycle, there are 3 major goals and priorities. The first is increasing access to care. That takes many forms. What you'll see when I'm presenting is it's hard to cram it into just a couple of slides, but we'll do our best. And I want to highlight always that we do this through a combination of braided funding streams. So what you see in blue are largely general funded programs, although there's maybe a little bit of grant supplementation. What you see in green is our non-general funded. So you can see how we try as much as possible to weave those together. We start by focusing on chronic disease. And I want to make it clear that nationally, there is very little money that goes to support chronic disease and prevention. So we have largely in the last few years had to do this sort of from scratch. We do have our direct service programs that are our legacy programs. Our HCH clinic, which has been around for decades, continues to serve our most vulnerable where they need it most. Our goal there is to continue to increase patient volume and linkages to care and to expand. It was our hope this year that we would have a footprint in New Orleans East, and we looked at many options, but unfortunately the federal uncertainty put that on pause. That still remains our highest priority, is to have a discrete footprint with our other service providers that are out in New Orleans East. So we're going to do that next year. We also focused on one of our lead drivers of chronic disease and mortality, and that's diabetes. In our community, we have higher rates of diabetes than most elsewhere. Thanks to some new capacity in the health department, we are the really only local outpost of the CDC's diabetes prevention program, which has launched at City Hall and been incredibly successful. So we're starting with city employees who are at risk of diabetes. We're meeting with them, providing nutritional support, and getting them to keep themselves healthy so that they do not go on to develop complications. Our Ryan White program, another legacy program that again is under significant federal threat to care for those living with HIV, has seen some great success in the number of people connected to care, those who are in treatment, and those who are living undetectable, which means they cannot transmit to others. We've been able to do that thanks to a significant infusion of federal resources. Even as that is under threat, we continue to have those goals. And really what we're doubling down now is our ability within that program to address social needs, because without food, without housing, without transportation, those gains will be lost. We talk a lot about our maternal child health programs. And again, this is a really broad and enmeshed system of both legacy direct funding programs like Healthy Start and WIC, and our newest one on the block, which is our postpartum home visiting program. We have been able in the last 2 years, and really it's only been fully operational in Orleans for a little over a year, to get to more than 50% of every birth in the city and provide them with this program. Our goal is 70%, and then our goal is 100%. We have already seen that this saves money, that it increases connections to pediatrician visits and OB visits. It increases the likelihood that we will diagnose your postpartum depression early and get you services. And it has been so successful that in the legislature we secured funding for commercial coverage, and we are working very hard to make this a full Medicaid covered service for the entire state of Louisiana. That is our goal for this year. Our other programs, again, face significant threats federally. And so we have spent a lot of time advocating for preserved funding, because we know that our Healthy Start program has reduced infant mortality, and we know that our WIC program helps people breastfeed and get the nutrition that we need. So we will continue to support those. In mental health, we've been able to expand significantly in the last few years. Mobile Crisis is a little bit over 2 years old. This year we expanded the number of call types, and we continue to do that. We are serving a little over 3,000 calls a year, and our goal is to increase that. We also have been working with them, and they will begin Medicaid billing. So again, reducing the city's investment in this to be more sustainable so we can continue to serve more. We are really excited about the launch of our mobile harm reduction unit using our opioid settlement funds. This is another great partnership. It's several different organizations, big ones and small, that partner together under our oversight that will be doing deep and significant services for those, for our SUD clients all over the city, in places where folks are, rather than expecting them to come to a fixed place. Our outreach and naloxone education will continue, and we're really excited to see where that goes. Thrive Kids is another really exciting opportunity. They're serving thousands of children. They're deeply in our most highest needs schools, and we now have an opportunity to leverage that to get a 3-to-1 federal match. And this is federal money that is actually not on the chopping block, if you can believe it. If we can secure that, if we can continue the city's commitment, we will be able to serve every child in Orleans Parish and be deeply in every school. And you probably have seen they just opened a clinic in New Orleans East where they expect to serve 5,000 kids with medical and behavioral health services that weren't there before. So this is another way we are leveraging an initial city investment to grow it significantly. Next slide. One of the major drivers of health outcomes is economic stability, if not the major driver. And so that has always been one of our primary goals. That is, in many ways, the hardest nut to crack because it involves so many different factors. We start with policy. Since HR 1 was passed, we've been working in coalition to mitigate the cuts. That's with our state partners, our advocacy partners. We know that the proposed changes to SNAP, to Medicaid, to the Affordable Care Act will have devastating effects on our community, and so we are actively working to mitigate those from day one. Part of that is what you see in our food and nutrition bucket is that we now are providing SNAP application assistance at 5 new city sites all over the city, because even now before the cuts, we know that this is a program that's underutilized, and it is a program that significantly improves health and social outcomes. We will continue to work on the continued threats to public health, whether it's vaccines, whether it's reproductive health, whether it's fluoride in the water, whether it's tobacco control or paid leave. We have a strong and vibrant series of coalitions that we do work in, and that is going to be a continued focus. We're very excited to have partnered with Step Up and the administration and council for the Healthy Workplace Certification Program. We really look forward to that being funded so that we can implement some great changes. And we continue to work on strengthening our own workforce. We have a quality of life committee at NOHD that we feel is critically important because we want everyone to feel valued and supported in their work here. It's really hard and it's really important. And that committee has also expanded its reach to the city. The new lactation rooms and the lactation policy, that came out of work that we did in our committee, and so we plan to continue that. In terms of food security, we have created a grant-funded position that focuses solely on food and nutrition. We have several ARPA-funded programs that we would very much like to continue when that money rolls off that provides healthy food at critical times in the pregnant and postpartum period and for medically fragile and vulnerable individuals. Next slide. Community safety for us means a wide array of programs. Our Office of Violence Prevention, in the 3 years since we came before you and talked about a strategic plan for violence prevention and evidence-based intervention, I hope that you see the results of that. We have developed what we call the violence prevention ecosystem, which is, again, multiple partners from our community interrupters, from our hospital-based violence intervention team, from the Trauma Recovery Center, from our gun safe storage initiative that's given out thousands of highly sought after biometric gun safe devices, to our domestic violence AIR program that's serving thousands of survivors every year. This has not been a huge investment when we look at investment in criminal justice systems. This is a small investment that has shown dividends. We know that there have been de-escalations, retaliations, mediations that have contributed significantly to our historic drop in crime. And so we really are hoping for continued investment, at least at the same levels. Public health threats also threaten community safety. And I think everybody has been on the roller coaster ride of vaccine access with us this year. We appreciate your support for that. We are in a much better place than we were, but we know that the threats continue. So we have partnered with physicians, we have partnered with community organizations on a communications campaign because we must fill the gap that is being left by the state and feds on vaccine safety, immunization, and just the importance of keeping our community safe in that way. We support Healthy Homes. We support the Office of Homeless Services in their highly successful encampment decommissioning effort with a public health first approach to housing our most vulnerable. And we continue our multi-agency work on every kind of threat you can imagine, from heat to salt to snow and everything in between. And then lastly, injuries are a leading cause of morbidity and mortality for our residents. But again, until a few years ago, we didn't really have anyone focused on injury prevention. We do now, thanks largely to grants. But what that's allowed us to do and what we plan to continue are free swimming lessons for 700 kids all over the city because we know that drowning is a major threat to children, free carbon monoxide detectors with the fire department, a whole lot of transportation and traffic fatality and safety review work, focusing on St. Claude, but also in every corner of the city. And then we're really excited to add DWI prevention. Again, that continues to be a real challenge in the city. We've been able to secure some funding, and so we're hoping that that will make the difference.
Dr.
So,
Abegno, can
yes.
I interrupt at
Sure.
this moment, please? So we have a lot of comment cards, but I do want to say something which is like some good news. And I'm going to stop and do something I don't ordinarily do, but make sure the council gets a lot of praise for this, which is as a result of settling Wisner with LSU and Tulane, the city has received about $5 million. The mayor and I met about this, and we're going to put that money back in the general fund at the mayor's request. I want to be very clear, the mayor has requested this for health department and NORD. So we're talking about a lot of cuts. But, there's a lot of clapping, but I think it's important for the public to know how much we've had to fight for this. And really, I'm looking at my colleagues because they're the ones responsible for making sure that we got this money and have worked to put it back into the general fund. And I know you're getting the budget impact, but we're doing our best to soften the blows for these two public safety agencies. Councilmember Thomas.
Yeah, thank you. I was going to wait till the presentation was over, but you talked about expansion of services. And post-Katrina, there was a demographic shift. The demographic shift pushed the most disparaged population out to New Orleans East and to Algiers. But something interesting didn't happen. All of the nonprofits and social service agencies that treat them didn't move where that distressed population went. They stayed downtown. And that still is a problem today. So there was a demographic shift for folk who were most in need, but everybody who services them, who gets millions and fills out their grant applications, they don't have an annex, they don't have headquarters, they don't have, very few even have an auxiliary office in New Orleans East or Algiers. So what is the plan there? And when you talk about Children's Hospital, that was a 2.5-year journey. I can pull up my receipts from meetings with them where we identified several buildings that were looking at the buildings near New Orleans East Hospital, that were looking at some of the other buildings that partnered with realtors and developers like Ms. Vergis and others before finally settling on where the Yep Center is at the old school on Haynes. But not enough of that is happening, especially given our transportation challenges and what we know. We haven't dealt with the root causes of violence and disparity, and we know the economic gap. Black children are poorer now than they were pre-Katrina. Single black women in Louisiana are some of the poorest in the nation. What is the plan to start to expand services to those distressed populations who are who've been pushed to the furthest ends of the city?
So thank you, Councilman Thomas. And I do want to make it clear, we've always had a physical footprint, and we have also made sure that our other universal programs serve New Orleans East in particular, because that's where the population base is. So when you hear about our Family Connects, our postpartum home visiting program, they serve the most in New Orleans East. That is where the largest number of their visits are, and they're going to them. So they're going to the homes.
Yeah, but more black babies are born in New Orleans East than
That's
any
right.
other municipal district, but Children's Hospital, until recently, didn't have a footprint in that area. So the data supports the service, but in many cases, the location of the service and the investment didn't support the data.
That's right. And that's why we look at our data very closely to make sure that any program that is universal is particularly concentrated in an area like the East that has the highest high rates. We also make sure that our violence prevention programs are serving proportionately, not disproportionately, but proportionately in the East, whether it's our community interrupters, whether it's our hospital teams. We would love that the clinic that Children's Hospital is in, it's a little bittersweet. We want to put another WIC location there, But that is a federally funded program that has not given us the additional funds to do what we need.
And so that is my question. First of all, thank you from your work before you came to the city, especially on violence prevention and some of the stuff that others didn't experience when we were doing Peacekeepers and Beef Mediators on the Walk. You had that experience. But the issue for me is that given the demographic shift, the social disparity, what do we do now? We have all of these nonprofits and organizations that fight for funding, but they don't have an office in New Orleans, East Algiers. Period. And that's where the most distressed demographic is. So you come here for money, but you don't even have the one side of a double in the area with the population that needs your services the most. So how do we, and what moving forward, what do you begin to do to encourage more of those agencies to say, hey, look, I know you like being downtown, but your people moved here. And they don't really have transportation, and we don't have regional transportation, and we don't really have metro transportation. So I would just want to know, what is the plan to expanding the footprint is one thing, but the services, that's a whole nother, because you can take a view of what the map is, but I'm just looking at the map. I don't have an office or an interest or a location in that part of the map.
Yeah, no, I think it's all of the above with the limited resources that we have. Again, anything that's universal, we can send to the area, right? They might not have an office, but they are going and serving people there. One of the things that we would like to do in the new CHIP process with our partners is figure out how to get philanthropic support to make micro grants to small organizations.
And I think that's my question,
Yeah.
is that because the partnerships are good, but there's so many other agencies out there that they'll partner based on getting funding, but not the location of where they service. Because to me, the age of these nonprofits and many of these organizations that say they service people having their office downtown, well, your service population, and I'll say it in my little Ninth Ward vernacular, you ain't downtown. You downtown, but the people you getting paid to service ain't downtown, and you taking a trip every now and then that may help satisfy you or shine your halo, but it doesn't service the people that are living in the edges of the community, across the river, on the other side of the canal, especially post-Katrina. All of the data shows where those service populations have been pushed, because those people, until they were gentrified in the center of the city, they used to live in the core of the city. Thank you.
So just getting into the nuts and bolts of it, we have 110 employees. In any given year, about 70% of those are grant funded. So this is a tremendous amount that is not relying on city funds at the moment. The security of those, of course, in the next few years is under question, but for now, we're holding steady. Next slide. When we look at our general fund expenses, we do see we received a 27% cut to our general fund budget. That is a significant cut, and I'll get into the impacts in a minute. We had one vacant FTE that was cut, and then there's a proposed budget reduction of unclassified, so that explains that. $3 million of a cut, to be honest, is a very difficult decision to make. I do appreciate, and thank you, Councilman Giarrusso, and again, thank you to the mayor and the administration for helping that Wisner Fund. That will continue to fund one of our violence interruption programs that we believe is critically important, and so we are really excited to have that funding back. But there are other programs that we've discussed that are all general funded, even as we work to leverage and to add on other sources of funding to bill Medicaid where we can. That takes time, and it doesn't quite cover a $3 million source, or cut, excuse me. Next slide. And grant funding, we've also seen a bit of a decrease. The personnel, we haven't, I want to make it clear, we have not actually cut grant-funded personnel. In previous years, HRSA in particular for our ACH clinic allowed us to have a cushion for personnel funds, so that, and now we don't. So that's not actual cuts to personnel. We still have the same number of grant funding personnel. In fact, we've increased as we've been able to move some onto a limited number of grants. We have seen a cut in our grants. Some of that is ARPA rolling off. Some of that is tightening of the federal budget. And remember, when we get federal funds, 8% of that comes to the city as an indirect cost. So not only are these services that the city doesn't have to pay for, but the city actually gets money off of them. Next slide. So I think for me and for my team, we've spent the last several months awake in the middle of the night, sort of wondering how we were going to make this work. We are going to try within limits to spread out the cuts so that we don't have to cut a single program, because I don't think I could do it if you asked me to choose between moms and babies or mental health or violence prevention or food. I don't think that would be appropriate. We are hoping that with some revenue generation ideas or maybe some reallocation of ARPA, we'll be able to do a haircut and not a shave. But we are facing the reality of delayed responses in our mental health crisis, in our domestic violence program. We really strongly believe in the universality of the postpartum home visiting. That is what increases equity. That is what gets results. And so we really don't want to cut that. We also do not want to cut any support for our victims of violence at a time when we're doing well. We can't backslide. And then, we know that other safety net programs are being dismantled. And so to add on to that is really more than our families can take. Next slide. You all asked for some no-cost improvement ideas. I have these. I have a whole list if you want the whole list. But I do think there's some low-hanging fruit that can make us run better. And when government is more efficient, it's more effective. Just simply getting rid of paper would save time, would save effort, it would save things getting lost or not knowing where something is. I mean, in 2025, we should be fully electronic routing document at every stage. If we had a city grants department and took that burden off of departments, you would make that money back with the first 2 or 3 grants with your indirect costs. So I don't know of any other major city that doesn't have some sort of centralized grant departments. Michonne and our team had we've used this effectively in the health department. Every department should have a champion that is looking at how to make changes and how to get buy-in. We've done this within our units and it's been tremendously successful for saying, yeah, we can go to DocuSign, we can do this, let me tell you all about it. And then, as I know you've heard, routing agreements has been an onerous process that, again, it's a headache for us, but who it really affects are the partners behind us. Because when they can't get their contract in 6 months of trying, then they can't pay people. And so we would really love to make that more efficient. And I just want to highlight, we do consider ourselves to be a fairly efficient department. We are 1.3% of the general fund budget. If you look at our peers, the closest peer to us is St. Louis, and they've got 2.8% of the general fund budget. 4 or 5% of the general fund budget going to a health department is about standard for a community like us with all of our resources and challenges. We are heavily non-general funds. We try to use every single dollar, leverage every single outside money to get our community the services that they need. And we'll continue to do that. That's my pledge to you. But we do need sustained city investment to do that. You all and the administration have always been strong champions of public health. We know that you face difficult decisions, and so we appreciate everything that you do. And I think that's all I have.
All right, thank you very much. We have an active board. Councilmember Green, Councilmember Harris, Councilmember Murray.
Before I go to my state spiel, which I bring up all the time, I do want to take an opportunity to thank the members of your team who are involved with the cleaning and decommissioning of homeless encampments. I attend each one that I can, and you're saving lives. I want to commend those who work behind the scenes, starting their work at 6:30 and 7 a.m. after they've gone to each resident of an encampment to speak to them about the opportunities that are available to them. Sometimes I see public comments or I see social media comments that suggest that the city is just taking the people and just dispersing them without knowing where they're going. I guess I'm going to ask you to comment on the record so that the many people who are watching us today and who are here can know and be assured that the city of New Orleans has the concerns of those who are in the encampments placed first. That is our priority. And can you tell me what happens when an encampment is decommissioned, such as was done just recently under I-610 on state-owned property?
Right. Well, we don't clear encampments.
And
We
decommission.
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 Right. And I know you said that, but I always want to make that to the public because it's a big, big difference. And
I want you to know I always use that word. You will never hear me say clear encampments because
Right.
I'm there. So I know that there's been discussion that has taken place before and even that morning before someone is given an option as to where they might be.
So I don't want to, I want to give full credit to the Office of Homeless Services who have really led this, but we have been their public health partner, and we've started with a public health approach to getting folks into the right place. Because that's what happens is when an encampment is closed, it's because folks there have been placed into housing or the right situation for them. If they didn't want any of that, that would be their choice. But we do that leading with trying to understand their health needs. And to date, we are at 92% of the 1,500 people that we all collectively promised we would house by the end of 2025. We are now taking on an expanded role, the health department is, because we know that for those who remain on the streets, many of them have serious medical and mental health issues that really make it impossible for them to go right into an apartment or right into a housing, even for supports. So we are leveraging, again, a new grant position of a public health nurse who will work with OHSS on complex cases, those very challenging people that you all see, that you get a million emails about from your constituents, but for whom the system does not have a great solution. And so we need to give an awful lot of attention and resources. So it's our hope in the next year that you're gonna see not just that we really don't have encampments anymore, not many, certainly not like we used to, but also that we are tackling the hardest folks and getting them, we hope, exactly what they need, which is what they haven't had before, if that answers your question.
Right, it does. So no one is left behind.
Right.
We're not simply moving into a location under a bridge and saying, everybody out of here.
Right.
We've contacted them in advance. And you're right to give credit also to the work, it's the Office of Homeless Services and Strategies. It's your office. It's the Office of the New Orleans Police Department. There's a lot of partners involved with that effort that quietly, under the radar, is helping to save lives. Can you also comment on this fact? Unbelievably, 2-3 years ago, there were 599 overdose deaths in the city of New Orleans. Another fact that doesn't get emphasized as we emphasize some other areas. But those are people and their families are hurting still. But this year, there's been a drastic reduction. Can you talk about that drastic reduction and send a message to those who need help so that they can get the help they need?
Yeah, that has been, again, if public health is a ground game, this one has been a very long ground game, and many, many, many partners, some of whom are in the room, have all worked together to bring those numbers down. We are now at the lowest level in several years, and that's through outreach, naloxone distribution, education, harm reduction, increased services. And again, that's what we hope to expand on with our new mobile unit. We're also looking at a communications campaign so that just what you said, people know there is help, there are resources, there is hope. That's something I feel strongly about. We need to do not just with Orleans Parish, because substance use doesn't stop at the parish line. We need to be doing this on a regional manner, because we don't want anybody in our community to be left behind. So it's a great success, but again, it's one that you can't just, give up in the third quarter, right? We got to finish the job. And in doing that, we're lucky. We do have some additional resources that allow us to focus on opioids. And so we do have a path that does not directly heavily rely just on city funds, But it's going to take all of us continuing to work together to keep that progress.
And can you talk for just a second about, in a diplomatic way, what the state of Louisiana can do more to help us? We know that some of the issues that we have here in the city, for example, are based on our position as a regional leader in providing services, such as in the areas of shelters for those who are unhoused and providing resources that deal with mental health, because some of our surrounding parishes have basically no services or very reduced amounts of service. Can you talk about the regional impact on some of our services that we have here and what you think the state can do to assist?
Yeah, and I want to say we work very, very closely with the Louisiana Department of Health on a wide variety of topics. Mental health is one of them. And as I explained to their secretary last week, in New Orleans, we can be the tip of the spear. We can be innovative, creative, and flexible, and we want you to use that as a model. Our mobile crisis unit is a model for the rest of the state. As the state is doing more in crisis care, I think what we want is for them to look to us an example and also help support us in what we're doing that's working. Homelessness is another great example of this. We really do need state investment to continue what we're doing because it's working. And I think the state saw that their, attempts to put everybody in a transitional shelter were very expensive, and maybe not quite as.
How much was it for 3 months?
Yeah, the contract was for $16 million. I'm not sure how much was.
The state spent
Yeah.
$16 million for 3 months to house people in a facility on the waterway, if you will, on the industrial canal, where we asked for $10 million to house over 100
Right.
for a year.
And I think, there are conversations being had with those who are influential at the state. I think that the OHSS's partnership with United Way to get folks through the shelters quickly is getting notice. And I think that there's just a real opportunity to work together on that, rather than just sound bites or, everybody kind of in their corners. It's not a huge investment that we need from the state, but it would be meaningful and continue the progress.
I appreciate your being diplomatic there. This is not an attempt to bash the state, because the state has its desires to do work in other areas, but it's certainly on the table that the state could help us a bit more.
Yeah.
All right, thank you. Thank you for the work that you do in your department.
Thank you, Councilmember Green. Before I get to my colleagues, we will not get to Park and Parkways and NORD by 11, so I don't want to keep people in here longer than necessary. If you all need to go take a break, I encourage you to do so. Also, it's 10:20 and I have 26 comment cards, so I'm going to take Councilmember Green's suggestion, limit everybody to 1 minute so I can get through the comments from the dais and get as many people heard as possible. Councilmember Harris, Vice President Moreno, President Morrell.
Yeah, thank you. To the Health Department, you are, if not the most functional portion of government, city government, and I just want to say thank you, Dr. Vegna, for your leadership and every person on your team. We can see this by the support that you have garnered behind you, and I don't think it was solicited. I think that people just know how impactful the health department has been. You really do have tentacles everywhere, from law enforcement to diversion to helping new mothers and children to helping folks who are impacted by addiction and mental health issues. So I just want to say thank you. We work closely with you. Allison from my team has worked in partnership with you and the Office of Homeless Strategies and Services to really bolster the services that we provide to our unhoused, and we work on that every single day. And again, I just want to say thank you. To the state, we need additional help, and we made that very clear on multiple occasions. We could certainly use additional state help with mental health support services, and I think that's statewide, but also to continue the work that we do well here in the city of New Orleans. I get calls, emails all the time from people who are seeing people in crisis, and I say, call MCIU, which is something that came from your department and has had great impact, as Barksdale said. One of the most functional programs that we have. So again, I just want to say thank you. I know we have a lot of comments. I don't want to take up too much time, but thank you, thank you, thank you.
Thank you, Councilmember Moreno.
Thank you. Good morning. The AIR program, that assists victims of domestic violence, that is now citywide. What is the cost of that program, and is it fully general fund?
So it is about 1.5 million all told, and that I believe includes the enhanced legal funding that we put in last year, and it is all general funds, yes.
Got it. And then for the general fund, it looks like you've got about 3.1 million for general fund personnel. How many employees is that? Do you have that number?
It's about, if we have 110 and it's about 35, if I'm doing the math right.
Okay, 30 fund general.
Yeah.
Okay.
I can get you the exact numbers of.
Got it. Okay, thank you.
Thank you, Councilmember Morel.
Thank you, Mr. Chairman. I want to thank you and the Health Department for always working cooperatively with every other department in the city of New Orleans. I think that it is very inspiring how when other departments look for help, you're always the first person to try and step in to try and solve their problems as well as your own. I want to say also just it is impressive how often you are the voice of sanity in government, to the point where Clay Higgins singles you out to call you a warlock.
Sorceress.
Sorceress.
Sorry.
Sorceress.
Sorceress. My apologies. It's particularly.
Warlock is a dude.
I cannot believe I just got out-nerded by Councilman Thomas. It's particularly painful when you're looking at these type of cuts when you're a department that, for the most part, when the federal government is running properly, you're borderline revenue neutral. And the challenge we have right now is the federal government is not operating properly, which means that services that people are entitled to because we all pay our taxes are now having to be subsidized by us. And I think one of the big issues that we're going to have to try and tackle collectively is part of the new regime is sending money that would have come to you to Baton Rouge for us to have to go fight for it. And it is going to completely change the paradigm in that we are going to have to work collectively to go to Baton Rouge and to unlock money that we are entitled to that's largely generated by population in need. And it really reminds me kind of how things were after Katrina, when all of our Katrina money got sent to Baton Rouge and we had to fight. The money was created, designated for our area due to a disaster, yet we had to fight to make sure the money wasn't spent on like stadiums in Ruston. And it's going to be very important with the new council members, with our delegation, regionally, because other similarly situated cities are going to have the same problems, to collectively go up there and really make the case on almost an annual basis through this term, federal presidential term, how we can collectively get our money back. Because even the money that we are looking for, it's just, it's very ironic in that all we're seeing at the federal level is additional levels of bureaucracy versus the reverse. Because when money was sent directly to health departments to be used for the population, that is the most cost-efficient, effective way to do it. By putting these different layers that we have to go through to get money unlocked for services you were already providing in the most efficient way, it really just creates more money for lobbyists in a lot of ways. The hardest part of all of this is we have seen the results of the work you've done. We have seen the results, whether it come to maternal health outcomes or whether it's violence interruption. And it's just painful looking at the budget realities, how we're going to do these Sophie's Choice of how we fund different departments that are doing tremendous work. But I want to highlight, like I said, I appreciate you coming with solutions, not just the problems. And I do think some of your suggestions, centralizing grants, getting rid of paper completely. The amount of money we have not just with paper, but with people processing paper, the lost time. If you knew how much paper we shuffle in city government right now, we probably kill rainforests daily. So we're certainly going to take those into account with the administration and find out what efficiencies can be done, because those efficiencies can be reinvested in the health department. Thank you.
Thank you. I'm going to start a fund for your walkout song. Is it Black Magic Woman? Is it, we can decide what it comes to, and raise funds for the city that way. All right, I'm going to call everybody's name 5 at a time, and we're just going to go given the time constraints. And if I mispronounce your name, as always, I'm sorry. Laura Tuggle, Annalise DeWolf, Christopher Levy Griffin, Maite Hernandez, and Charlene Ho.
Good morning. My name's Laura Tuggle. I'm the director at Southeast Louisiana Legal Services. And I just want to thank the council and also the health department and all the heroes at the health department for helping recognize the importance of civil legal services when it comes to violence prevention. And we do a lot of work sort of in this area. We're most well known for our domestic violence work, and we're very proud to be partnering on the AIR project. But we also have attorneys that help staff the Trauma Recovery Center at UMC. We partner with Eden House for trafficking victims. And a lot of the work we do with the unhoused population, unfortunately, we have a number of clients that are victims of robberies, hit and runs, all kinds of things. And we end up working on legal issues to help them stabilize their lives. I just want to mention, in terms of the AIR project, which we were added to last year, our budget is
Thank
about...
you, that's your time.
That's all I can say?
Yeah.
Well,
Yep, sorry. I'm trying to keep everybody to 1 minute so we can hear from all the speakers. Annalise DeWolf, and again, I apologize if I butchered your name. All right, there you go. 1 minute on the clock.
Okay. Thank you, council members, for hearing this, and the health department for the great work they're doing. I am Dr. Annalise DeWolf. I run the violence intervention program at UMC, which is one of the programs in the health department budget. I want to say this is a smart investment. We work with individuals in that crisis moment when they first come to the hospital after being shot, and long-term to help them reduce risk of further injury and to support them with those social drivers of health. A 2023 study estimated that the municipal cost of a homicide is over $1.2 million, and non-fatal shootings is almost $700,000. That's accounting for police, EMS, legal, victim services. That cost of one homicide exceeds our current yearly budget. We engage with over 300 people a year. We've had people tell us 40 times that we have stopped that shooting. That is a cost saving of $28 to $48 million so far. So this is a good investment, and you will save.
Thank you very much. All right, Christopher Griffin, Maite Hernandez, Charlene Ho, Lonnie Grenier, Sandy Hyatt. Good morning.
Good morning. My name is Levi Griffin, and I'm a postdoctoral researcher working with Family Connects at Ochsner Baptist. I just wanted to give a brief overview of kind of the impacts we've had since starting at Family Connects at Ochsner. Firstly, more broadly, Tulane's ongoing evaluation of the Family Connects New Orleans program overall has shown significant improvements in mothers and babies attending postpartum and newborn appointments. And early findings suggest a pattern of decreased Medicaid spending for participant families as well. Second, on health outcomes, at Ochsner specifically, we've seen that after Family Connects launched, eligible mothers received blood pressure checks much sooner than before the program came to Ochsner. And that matters because early detection of hypertension can prevent serious postpartum complications like preeclampsia, eclampsia, and stroke. Finally, from the families themselves, 100% of our patients say they'd recommend Family Connects. One mother told us, "I wish I'd had this resource during my first pregnancy. It's so nice to have someone who could check on baby as well as me, and there was no judgment."
Thank you. Maite Hernandez, Charlene Ho, Lonnie Grenier, Sandy Hyatt, Sophia Rosenblatt.
Hi, good morning. My name is Maite Hernandez, and I'm here on behalf of LEAD, the Law Enforcement Assisted Diversion Program. LEAD provides police officers an alternative to divert individuals into case management services at the point of an arrest, and our results are powerful. We have connected people to housing, substance use treatment, employment. One of our participants has a history of 300 NOPD interactions and has had 0 new incarcerations, is working and maintaining sobriety, and even providing peer support services. In addition, LEAD participants show an 88% reduction in jail admissions after enrollment. That means they're far less likely to be arrested again. And that also goes with our data of 72% reductions in jail days after enrollment. Investing in LEAD is saving taxpayers' dollars. It's also changing lives. When we have somebody with 300 NOPD interactions that's no longer cycling through the system, that's a win. That's a win for public safety, and that's a win for you all. Thank you.
Thank you. All right, Charlene Ho, Lonnie Grenier, Sandy Hyatt, Sophia Rosenblatt, and Samantha Florner.
Good morning. I'm not going to repeat a lot of the things that Levi said, but I'm Charlene. I'm the Director of Community Health at Ochsner, and I oversee the program at Ochsner Baptist. I just want to advocate for Family Connects New Orleans. This is a vital universal home visiting program. It plays a key role in improving maternal and infant health across our community. Thank you to your support. All families in the Orleans Parish have been able to access this service at no cost during one of their most important and vulnerable times. And since our launch, we've seen nearly 600 families, and we've been live for a year and a half. And so this is, we believe every family deserves care, compassion, and support, and you make this possible. Thank you.
Thank you so much. Lonnie, Sandy Hyatt, Sophia Rosenblatt, Samantha Florner, Rose Preston. Good morning. Let's see if we can get your mic hot.
Good morning.
There you go.
Good morning, council members. Lonnie Grenier, Policy and Advocacy Manager for Odyssey House, Louisiana. We would like to request that $1.475 million be prioritized for the City of New Orleans Sobering Center program and the Health Department's fiscal year 26 budget. This would be level funding from last fiscal year. As the operator of the Sobering Center since its inception, OHL has proudly partnered with the city to provide a safe, compassionate, and effective alternative to jail and emergency rooms for individuals experiencing acute intoxication in our city. Over the last 9 months, we have served approximately 659 unduplicated individuals, over 3,353 interactions, totaling $330 per interaction. A recent economic impact report has also indicated that the Sobering Center provides $10.2 million in cost savings to the city and state associated with acute public intoxication. Thank you for the opportunity, and we look forward to working in partnership with the Moreno administration.
Thank you. All right, Sandy Hyatt, Sophia Rosenblatt, Samantha Florner, Rose Preston, and Jace.
Good morning. My name is Sandy Hyatt, and I'm the Associate Program Director for Seeds of NOLA Trauma Recovery Center. I want to thank you and the Health Department for your continued investment. Because of your investment, we've expanded the number of patients we've served, brought in new providers, and created a stronger network of healing across our community. But let me tell you what that means for people. One of these people represented was a young woman who lost her eye in a shooting, who through that trauma therapy and support found the courage to enroll in nursing school so she could help others who were injured like her. They represent the retired community member who, after being shot, found new purpose in becoming a minister and dedicating his life to rewriting the story of his neighborhood. They represent the teenager who wasn't sure she'd be able to graduate high school, who is now thriving in her first semester of college, believing in a future she once thought was out of reach. These are our neighbors. Their healing wouldn't be possible without your support. It strengthens our families, our community, and our future. Thank you.
Thank you. Sophia?
Good morning. My name is Sophia Rosenblatt, and I'm the Director of Programs and Partnerships for Saul's Light, a local nonprofit that supports families with infants in the neonatal intensive care unit or the NICU. Thank you all for your support of these important initiatives. Family Connects is a service that provides valuable care to parents throughout New Orleans, and I strongly encourage a continuation of your support in this program. We're partnering Family Connects to bring hospital-grade breast pumps to NICU families, an initiative that closes gaps in care. It also ensures medically fragile and premature babies have access to human milk, which is a life-saving resource for NICU infants. We are also partnering with the health department to bring emergency preparedness kits to NICU families. These kits ensure families will have essential resources and information during hurricanes, outages, and evacuations. In the upcoming budget, I encourage your continued support for Family Connects programming. Thank you all.
Thank you so much. Samantha?
Hello, my name is Samantha Florinor, speaking on behalf of the New Orleans Food Policy Council. I'm also in partnership with the Big Easy Budget Coalition. First, I want to thank the NOHD team. You guys have been invaluable to the work of food security in the city. And while food is not an explicit line in the budget, it lives in 3 places at the city, one of which is at NOHD through their programming. Any threat to spending here, cut to spending here, is a cut to health, safety, and well-being of residents. With cuts and added restrictions at the federal level to federal programs like SNAP and the current government shutdown, it is more important than ever to safeguard the health department. While New Orleans is known as a food destination, we do a pretty poor job of feeding our own residents. The health department has been a key ally in addressing the challenges facing residents as it pertains to food, including providing SNAP application assistance, helping food assistance. So please, I implore you to maintain their funding.
Thank you. Rose Preston, Ann Jays, Sarah Jane Guidry, it looks like Jakina Wheeler with Vera Institute on Music Street, Mary Claire Landry.
Hello, my name is Rose Preston and I'm with Crime Survivors NOLA. We offer a free guide to help New Orleans people navigate life after violence, and we participated in the advocacy to expand UMC's Trauma Recovery Clinic to align with the National Trauma Recovery Center model, a gold standard for trauma care after violence. The expanded Seeds of NOLA Trauma Recovery Center at UMC is in a unique position to engage with individuals and offer wraparound care during a pivotal crisis moment directly after they experience violence, a true turning point that can change the trajectory of a life. Wraparound trauma care reduces long-term medical costs, decreases hospital readmissions, improves mental health outcomes, and reduces community violence. Importantly, this funding through the health department means that families can access the vital services without being.
Thank you so much. Ann?
I'm Ann Jays with Louisiana Public Health Institute. Our mission is to ensure that everyone in Louisiana has fair and just opportunities to be healthy and well, and the New Orleans Health Department is critical to recognizing that mission. They really serve as the cornerstone of maternal health interventions in the city of New Orleans and act as an example for what the rest of the state can do. One example is the Family Connects program. In a state facing some of the nation's worst maternal health infant outcomes, Family Connects has measurable results. Families participating in the program experience 50% lower rates of infant emergency room care, including ER visits and inpatient stays. Family Connects families also report 15% higher community connections and more frequent use of community-based services at 6 months. For every dollar invested in Family Connects, there is a $3 savings in emergency room care, and so I ask you to support the New Orleans Health Department. Thank you.
Perfect. Thank you. Sarah Jane?
Good morning. My name is Sarah Jane Guidry. I serve as the Director of Policy for Crescent Care, one of our city's federally qualified health centers. Programs like the Mobile Crisis Intervention Unit is essential for a safer, healthier city. They don't just respond to emergencies, they prevent them. It's critical to recognize that public health investments save both lives and dollars. According to the National Council of Mental Wellbeing, mobile crisis response programs like ours divert up to 80% of behavioral health calls from EMS and police, saving an average of $1,400 per emergency room visit, reducing unnecessary arrests by as much as 80%. But every prevented crisis is not just a cost avoided, it is a human victory. When public health funding is cut, emergencies rise, and those costs inevitably shift to law enforcement. The legislative auditor's analysis found last year that the budget of $9.8 million for overtime actually spent $47. That's a downstream cost of a reactive system, and public health is an upstream solution. Please support the New Orleans Health Department.
Thank you.
Good morning. I'm Jakivia Wheeler, a District D resident, a senior research associate with the Louisiana Office of the Vera Institute of Justice, and a member of the Big Easy Budget Coalition. I'm also an evaluator of the New Orleans Community Violence Intervention and Prevention Initiative, coordinated by the New Orleans Health Department. I'm asking that you, as the New Orleans City Council, oppose the proposed 27% cut to NOHD's budget and take measures necessary to sustain the funding that the health and safety of your constituents relies on. I'm happy to hear from Councilmember Giarrusso that this cut already has the potential to be less severe. Among programs that could be gravely affected by cuts to NOHD's budget are those implemented or coordinated by the Office of Violence Prevention, which include the community-based violence intervention program led by Ubuntu Village NOLA, UMC's hospital-based violence intervention program, and the Seeds of NOLA trauma recovery program. These programs have bolstered reductions in violence in recent years and are what work to prevent harm and keep us safe.
Thank you. Mary Claire Landry, Dr. Charlotte Parent, Catherine Autry, Erica Zucker, Nadine Sanchez.
I'm going to be very brief, and I'm here to represent the New Orleans Family Justice Center in support of the AIR program. But more importantly, I'm here to thank Dr. Jennifer Avegno, because her vision and her commitment to best practices and accountability has been unmatched in the decades that I have worked in this field. And so I want to thank you, Jen, for everything that you have done. And I want to just be supportive of every single initiative that she is working. And I also want to thank from the bottom of my heart the support that we have gotten from the New Orleans City Council for really understanding and embracing and committing resources to victims of violence. That has also been unmatched. And I want to thank each and every one of you for supporting this work. And I don't know how many survivors that we save every year. I know on one hand, I can count the ones that have been killed, but I know.
Thank you. Thank you so much. Dr. Parent?
Well, good morning, everyone. My name is Charlotte Parent. I am the executive sponsor of the Trauma Recovery Center at University Medical Center, but I am also a previous health director for the city of New Orleans and Jen's predecessor. I just want to say, of course, support the Trauma Recovery Center, the work that's going on at UMC, the work with Ubuntu Village, and the whole violence ecosystem that Jen is trying to build. But more importantly, the work that goes on at this health department for that 1/3 of general funds that we get and that 84% of grant funding that we get, no one knows how to stretch a dollar better. And we have continued to do that for years and years and years, and I am thrilled with where this health department is going. So thank you very much, and continued support, and if you need anything from us at UMC, let me know. Thank you.
Thank you, Dr. Parent. All right, Catherine Autry.
Hello, my name is Catherine Autry. I am the RN Clinical Manager for the Family Connects New Orleans at Toro. And I've been here several times, and I don't want to repeat what's been said, but this program is vital to our moms and our babies. They are my passion. And New Orleans is my home for life. And as we've mentioned, the New Orleans East area is our largest population of moms who we see. We are in the intimate setting of these moms' homes, and we find out the most intimate things about their lives that we never see at the bedside in my 15 years of working with NICU and nursery moms. So in those homes, we help those moms with any and every issue, whether it's theirs, their family members, their home environment, their babies. We are connecting them to all of these resources that the New Orleans Health Department provides. And we've made over 200 referrals in the last 6 months to these resources. So we need all of them to get these moms' futures 100%.
Thank you. Is Erica Nadine Sanchez, Roberta Dubelstedt, I'm butchering that, Nisha Rose Davison, and Kaylin Green.
Good morning. I'm Erica Zucker. I'm the co-director of the Workplace Justice Project. We are a member of the Big Easy Budget Coalition, and we have served as part of the Department of Health's Community Health Initiative program. I want to make sure that supporting the Big Easy Budget deal and I want to thank the department for working so hard to look at an expansive view of the public health, including increasing economic security. New Orleans voters and this council overwhelmingly supported the Workers' Bill of Rights, and we need to fund the mechanisms to promote and ensure healthy workplaces and workers' rights. That requires funding to implement, to educate, and to enforce those programs, and I want to ensure that I would ask this council to please ensure full funding for all of those programs to ensure the importance of CHIP and the economic security mandate of this department. Thank you.
Thank you. Nadine Sanchez?
Good morning. My name is Nadia Sanchez. I'm the founder of Love Your Neighbor NOLA. We are a nonprofit that works in New Orleans East. We work with families, and we are proud to represent and partner with Family Connects. I do have to say, I wouldn't be here today after losing my mom to a carjacking in 2018. My husband suffered a traumatic brain injury. The mental recovery would not have been possible without UMC. I have to thank Dr. Rajo personally for truly bringing my husband back to life. Those funds are vital. I have to speak, though, to the work of Family Connects. They're one of our strongest partners. Like Ms. Catherine said, she's actually volunteered with us. She goes into the homes along with her other nurses. She gets to know the families, and they have been a strong community partner. They make sure families have the resources they need. They come to our office. They pick up playpens and strollers and diapers and all those tangible goods, but they also provide vital preventive care through intervention of postpartum depression, providing the resources that families need, especially in New Orleans East, where it's critical and families are underserved. Thank you.
Thank you so much. Sorry about getting your name wrong. Roberta? Is Roberta Ducelet here?
Skip Roberta.
Skip Roberta? Okay. Nisha Rose Davison? Kaylin Green, Dr. Erica Rojo, Samara Smith, Dominique Legree.
Hi, good morning. I think it's still morning. Nisha Rose Davison. I'm the Associate Director of Operations for the Mary Amelia Center for Women's Health Equity Research. I come here in support of two programs we've heard so much about, Family Connects, that's serving, providing universal postpartum home visiting programs to every family with a nurse visit, and we've heard wonderful things about that. And also the Office of Violence Prevention and its supported programs, including violence interruption, trauma recovery, and the mobile recovery unit. These are all addressing root causes of violence through a true public health approach. So these programs, Families Connects, and the Violence Preventions Program, they prevent future tragedy and higher costs. They build healthier communities, safer families and neighborhoods, and reduce the burdens on hospitals, schools, and emergency systems. Through these findings, through supporting programs like this, one thing is clear: when the city invests in equitable, evidence-based maternal and child health and violence prevention programs, we see measurable improvements. So we thank you for your continued support of these programs.
Thank you so much. Go on to the podium.
Good morning. My name is Kaylin Green, and I lead our gun safety program at Manning Family Children's. We're deeply proud of this partnership and the violence prevention ecosystem that we've built together with our health department, Office of Violence Prevention, Ubuntu Village, and our other community partners. Through this partnership and this council's investment, we've been able to reach thousands of families across New Orleans and been able to have immediate and measurable impact. An impact so real that just last night, we gave away a biometric gun safe to a mother who expressed to us that her son is currently recovering from a gunshot wound to the head. This is exactly what we're doing every single day, and the impact that your investment makes possible. We're able to stand on the front lines of crisis and be a trusted place for families to turn when they have nowhere else to go. We can't lose that momentum because our kids and our city's futures are depending on it. We're grateful for the council's continued investment in this partnership, and we hope to see that investment continue moving forward. This funding does not just sustain a program, it sustains safety and saves lives. Thank you.
Thank you so much. Dr. Rojo, are you here? There you are. Samara Smith next, Dominique Legree, Melanie Richardson, and then Chandra Shea Foster to close this out.
Good morning, Council. I'm Dr. Erica Rajo, and I am a New Orleans resident and also a mental health professional who specializes in trauma and the director of Seeds of NOLA Trauma Recovery Center at UMC. First, I want to thank you for the resources you've provided thus far. Your investment has allowed us to grow our capacity 93% in services provided in the first year and to reach more survivors when they need us most, including the survivors of the January 1st Bourbon Street terror attack. The Trauma Recovery Center is a vital component of the city's violence prevention ecosystem by serving survivors of violent crime at their most vulnerable moments, providing trauma-informed intervention in the immediate aftermath, as well as ongoing evidence-based trauma therapy and wraparound support services. The Seeds of NOLA Trauma Recovery Center represents New Orleans' commitment to healing, and every dollar invested in trauma recovery goes towards breaking cycles of violence and trauma. What's not healed in one generation is passed on to the next, so access to trauma recovery services.
Thank you so much. Samara Smith?
Good morning. My name is Samara Smith. I am the New Orleans Economic Justice Organizer at Step Up Louisiana and a District A resident. Thank you for the Council and the Health Department for being here today. When we say public safety is public health, that should mean more money for the Health Department, not less. The current proposed budget gives the Health Department less than 6% of the proposed NOPD budget, and yet the Health Department operates the programs that protect our most vulnerable and stop violence before it happens. The Health Department has shown they are responsible with public dollars, and even small increases can provide major gains to our communities. This isn't just about restoring the Health Department's funding, but increasing it. We support every ask in the Big Easy budget deal, in particular the Healthy Workplace Program, which is an investment of only $150,000. For too long, working people have been left behind by leaders prioritizing profit-driven corporations over people. In New Orleans, the residents of the wealthiest majority white neighborhoods are living 20 years longer than residents of the poorest majority black neighborhoods. That is unacceptable. It's time for our city government to prioritize the people who run.
Thank you. Dominique Bree, Melanie Richardson, and Chandra Shea Foster. Ms. Dominique, thank you.
Hello, Council. My name is Dominique. I'm going to ask the whole ecosystem of the violence to stand while I speak, please. With the people who stand, and we all stand together. And with this ecosystem, we've been able to help people that need to escape violence get to safety. We've been able to walk with individuals who's been shot and see them graduate from college to have a different view in life with all the support as an organization that we all provide. I'm from Ubuntu Village, and with our peace ambassadors, with them, Avon, you guys have seen our signs. It's a conversation piece that brings us together to be able to work against violence and do preventative work also too, with showing the people the difference in what they can do. So thank you to the Health Department for supporting us, and thank you for listening to us.
Thank you. Melanie Richardson and Chandra Shea Foster.
Good morning, council members. My name is Chandra Shea Foster, and I serve as the Louisiana Policy Director for the Southern Poverty Law Center. I am also a resident of Orleans Parish and a proud member of the Big Easy Budget Coalition. A healthy New Orleans is a safe New Orleans. That's why I'm here to urge you to fully fund and invest in the New Orleans Health Department. The coalition's proposal calls for a $6.2 million investment, not a $3.2 million cut, to expand community-based violence intervention and prevention programs, address food insecurity, and sustain restorative programs that build a continuum of care for our youth. These are not just line items, they are life-saving services. Every dollar invested in the health and prevention saves lives, reduces crime, and strengthens our communities. I urge you to support a budget that prioritizes health, safety, and dignity for every resident of New Orleans. Thank you.
Thank you. All right.
Good morning. My name is Melanie Richardson, and I'm the Executive Director of Training Grounds, a local nonprofit that has supported more than 4,000 parents and children across New Orleans since 2016. Every week I meet parents who love their babies deeply, but feel unsure and overwhelmed after coming home from the hospital. A simple check-in, a listening ear, or a connection to a trusted resource can make all the difference. That's why Family Connect matters. It ensures that no parent is left to figure out things alone. We see this impact every day. Families first reach through newborn visits, later show up at the We Play centers, either in New Orleans East or at the Treme location. But not only are they coming with their newborns, they're bringing their toddlers as well. And so not only is Family Connect connecting and helping those that have newborns, but they're also helping those toddlers that could use more support. And so I want us to see that it is more than just the new.
Thank you. I know Councilmember Thomas has one more question, but I just want to read the names of the other people who had comment cards. And if I get anybody wrong, I'm sorry. Taisha Rhodes with Mobile Crisis Intervention Unit, Dr. Melissa Golden Evans with Tulane School of Public Health, Haley Blosh with Manning Family Children's Thrive Kids, Monica Salazar Alvarado, also with Manning Family Children's Thrive Kids, Venus Parker, Manning Family Children's, also Thrive Kids, Laura Potts, also Manning Family Children's Thrive Kids, and Sarah Amojola with Vera. So thank you all for being here today. We appreciate it, and Councilmember Thomas.
Yeah, first, I think Dr. Avegno is appropriate to ask this question, but also for this group here who's fighting for justice and correct funding, just to give you guys something to think about. Dr. Avegno, you remember several years before you came here, when you worked with a group of about 95% black men and targeted an area, it actually had the highest overall reduction of violent crime of any community in America at that time. I think the area in Central City that had dominated murders, when the city had 300 or 400 murders for years, you could count on more than a third and sometimes half being in that area. Not New Orleans East, that's just a side. But they never stereotyped that area. But the important thing for me to you is that we're looking at all of these social ills and all of these certain segments. And for all of the great women here, I've never known a life where women weren't in charge. My mother and grandmother were always the foundation of our community. But the CNBC report on the nation's economy in February 24 said that black men and boys are missing from the nation's economy. The Brookings Institute, in their commission with Marco Rubio and former Vice President Kamala Harris, in their report on black men and boys nationally, it said, to be male and poor and African American is to confront on a daily basis a deeply held ism that exists in every social institution. Now, I'm not going to say the name of the council member, but we have been paying attention the last several years, and I have pictures and documentation of everyone who's come here asking for funding, many of the major players who've sat before the council, and 80% of them don't have a black male at the table or leading an organization. How can our community be whole with half? If we're going to look at where black men and boys out of the economy, increasingly in institutions, out of jobs, out of homes, and out of colleges, at what point do we begin to take a holistic look to say that especially the African American community can't just survive with just one gender participating, or can't survive with just half? And you know all the data that I just read to you. So at what point does it become important, especially with institutions where their leaders don't represent that what is being called that missing link of America? How can we ever be safe? How can we ever be whole? How can our families ever approach the numbers that they did in the 60s if half of our social representation is missing, and there isn't a concentration to increase participation economically, socially, academically, and with social service? Not trying to upset none of the great women out there, but those are all factual data.
Yeah. Well, I think if you,
Yeah, the men ought to at least clap. I'm really representing y'all.
I was going to say, I think if you look out here, you will see a better number than you often see in coalitions in New Orleans, particularly those that are more economically resourced than we are. So good representation, not 50%, you're right, from Black men. And I know that it is the Black men who are doing the very hard work of community outreach, particularly in our violence interruption and our mobile crisis unit. So they are the ones on the front lines, and we cannot do anything without them. But part of it is investing in them from before they are born. And that's why, because as you know, birth outcomes are not equitable, and the hits that our infants and our children take are not equitable by race or gender. And so investing in families and giving them what they need for that infant development, that brain development, that school development and support there is how we win the long game. There's a short game and a long game. And the short game is the list of partners at our table, making sure that we're not leaving anyone out. And I hope that if there's anyone that feels like they're not involved in they will email me today. And highlighting the work that they do day in, day out, but we've also got to build it from the ground up.
Well, the data and the images, and I'll compile the list of pictures that I've taken over the last several years to show that whenever there was a request for funding or leading an organization, that very rarely was there an African-American male at the table or leading an organization. I'll share that with you. Okay. So at some point as we move forward, I think at some point we have to consider that participation economically and socially. You know, after all, Black men are chastised because they didn't vote. There were people from Barack Obama to others who said if they had voted more, Kamala Harris would be president. But I can assure you, if we take an interest that they're out of the home, out of the neighborhood, out of the school, out of the college, out of the job, and out of the economy, if there's the same fervor to fight for them being in those 6 places, you wouldn't have to worry about them being in the voting booth. And if the voting booth is the most important place where you place value on Black men, then we're never going to fix the problem that we have in our community. Because if all those other social places from the economy to the home were important, then I would think that you would see more representation in their civic participation. Thank y'all.
Thank you. All right, well, that concludes this morning. We'll come back at 2 o'clock for the remaining 2 departments. Thanks, everybody. Stand at ease.